Informing of a 100-day challenge the Health and Family Welfare Department is taking on to, quote, address certain aspects of provision of healthcare. Newly inducted Health and Family Welfare Minister Dr. Ampareen Lyngdoh today said that she will work to improve healthcare system in the state. Speaking to Meghalaya Legislative Assembly channel, Dr. Ampareen shared that special focus will be put to address challenges including MMR and IMR rates, cancer care, access to healthcare facilities and more.
Yesterday I was briefed by the Health Department in the leadership of the Principal Secretary, and few things that were brought to my attention. The first thing is that the state of Meghalaya is actually going to be allowing, the Department of Health is going to be allowing the people of Meghalaya to become part and parcel of the auditing of services provided by the Health Department to the various various citizens. For example, in order to address the MMR and IMR rates in the state of Meghalaya, the department is now going to be involving traditional heads and other stakeholders at the last mile to ensure that we redress the various reasons for this high MMR and IMR rates in the state of Meghalaya. Firstly, we need to address the issues that make women vulnerable. So you must have seen in the last 5 years the Honorable Chief Minister, through his Save Motherhood app and the efforts that he has put in place several facilities for the people of the state of Meghalaya. I was surprised to see that large numbers of villages remain to be very challenged on road communications. So there's going to be this concerted effort put in by all line departments to address safety of women at the time when they're actually in the family way. So that's going to be one of the things that is going to be very proactive in order to address this huge challenge of MMR that is there in the state of Meghalaya. There's a big effort also being put in to ensure that the first 2 weeks of the life of every newborn child is attended to. So you have the ASHA intervention, then you have the village, entire village, force that is going to be also roped in to ensure that every child has the right systems in place to survive once they come into this world. So this is again something which is an innovative mission. It is an innovative way of involving the public to also help every child have a fair chance of survival and a high rate of survival. So this is something which I thought was unique in the state of Meghalaya. The other thing is that we're going to be focusing in a large way on cancer. It's one of the highest killer diseases in the state of Meghalaya. Tomorrow I'll be going to the cancer hospital in Shillong, and I'm going to be reviewing the facilities for cancer patients. The universal health scheme is also going to be addressed in a large way, because we need to ensure that 100% citizens of the state of Meghalaya have access to healthcare facilities, not just the facility per se, but also the cost to right to life. So that's going to be very good. We are also looking at the possibility of ensuring that tuberculosis is addressed. Again, we've seen that this is also a very, very big challenge in the state of Meghalaya, so we're going to be focusing our attention there. Then we are also looking at improvement of health facilities and healthcare across the board. The NHA in many ways is already doing a lot towards infrastructure building, towards manpower provision, but we feel that we need to still make sure that we work hard to ensure that there is going to be a definite improvement in healthcare in the state of Meghalaya. In the health department, we are aware that we still have a lot of challenges, infrastructure, for example, and the lack of infrastructure. So certain revamping was done in the last 5 years, I have been informed. And I hope that now, as we move to the next 5-year plan, we would have addressed a lot of those challenges that were there. A lot of data is there, a lot of information has been collected, and now what is required is for the Department of Health, which is a key department, the Department of Agriculture, which is a key department in the state of Meghalaya, are directed in the right direction with the right intention. It will be tough, but let us see. Give me 6 months to understand these two departments better, and I'm confident that with the help of my Honourable Chief Minister and our colleagues in the Cabinet and the Legislative Assembly members in general, we'll all be part of this system where we can have a collective responsibility of delivering better to the citizens of the state of Meghalaya. The Department of Health seemed to be quite well informed and is making a lot of efforts to ensure that all of those requirements are attended to in as short a time as possible and in as sure a manner as possible. Yes, there was a shortage of doctors, but recently I was briefed that several doctors were also appointed. However, as per the indexes, I'm not sure which index was that says that we are still very short of doctors in general. Specialists, I did see a slide which talked about the numbers of specialists that we have in the state of Meghalaya, but like I told you, I will need some time to understand these a little more deeply and to be able to comment so that there will be the correct attention on the importance of having the manpower. And like I said, the NHM already gives us that additional budgetary provision and that additional provision for the placement of manpower as per their requirements in various health facilities across the state of Meghalaya.